past year has been our emergency department renovation. That was an 18-month project, so it was quite challenging because we still continue to provide care to our patients while trying to renovate the emergency room in different phases. We just finished that up. We had very good communication with our ED director, our infection control nurse, and then our contractor involved in the project. When we complete a project and everyone's completely satisfied and it's gone smoothly, I take great pride in that. I just like being able to support those who have direct patient care because I don't have the direct patient care. Keeping our building and our mechanicals in good working order makes others have a safe environment for our volunteers, our patients, and our staff members.
Healthcare is under incredible change right now, and that's the same for TriHealth. We've added a lot of new physicians into the organization. We've added some new hospitals. We've added specialists. So for me, as chairman of the Safety and Quality Committee, the goal was to make sure safety stays at the forefront. There's a tremendous human toll. When someone comes in, whether it's a health crisis or an elective surgery, they don't want to have another consequence, an unintended or avoidable consequence from something. But I've seen continued improvement, whether it's reduction in medication errors or reduction in infections or improvement in how fast we get a heart attack patient into treatment, and watching that whole process over time and making sure that patient safety and quality has really stayed as not just a focal point for the organization, but a critical element for the strategy of the organization.
Our role is to help every individual believe and feel that they have an important role to play in our patient safety. We've been involved with 9 other hospitals, systems in 4 Midwestern states in concentrating on a systematic cultural change for patient safety. We've learned in this collaborative, our number one, to have a daily safety call, 9 o'clock every morning. We have 31 directors, managers in a room, and they look back 24 hours and ahead 24 hours in their departments and report on any safety issues. Some of the other things that we've worked on are safety stories. We believe that data tells us what to do, but stories tell us why we do it. The work that we do with our staff, with our physicians around patient safety is really what our patients need, our organization needs, and our country needs at this particular time.
Infection control, and I think control could be used as another word for prevention, is all about stopping infections that have not yet occurred in patients. Because it was my field and because I was involved in it, I felt that we should do the best job we could at still allowing them to come to the hospital, get all those treatments that would be helpful to them, and keep their chance of complications as low as possible. In 2009, there was a big outbreak of C. difficile colitis at our hospital. We realized that what we were doing was not sufficient enough. We had to focus and spend a lot of time on that and try to analyze what we were doing wrong. We were able to change the infection rate considerably from a number of mid-30s to a number of 5, which was quite an improvement, and we were quite happy about that.
I'm a maternal fetal medicine specialist, which is a specialist in obstetrics, and we work with complicated pregnancies. I began getting involved in a newly formed state organization called the Ohio Perinatal Quality Collaborative, which is a collaborative between obstetricians and neonatologists across the state of Ohio. And our first project was around reducing deliveries that were not indicated before 39 weeks. We've been able to reduce the number of babies born before 39 weeks by about 1,000 per year. And by doing that, we've been able to save the state of Ohio approximately $25 million. One of the things that we say at TriHealth is we're the largest obstetric provider in Ohio, but we want to also be the best.
So
So my focus area this past year has been to really work to get every staff member to realize that the work doesn't happen in a meeting necessarily, but where the power lies is at the bedside. They have two jobs. One is to do the work and one is to improve the work. And once they understand that, the power of what they can do to improve and prevent errors is phenomenal. We've been able to reduce our surgical site infection rate dramatically. We have also been able to improve our handoff process. Falls with harm are practically non-existent. My dad suffered an extremely severe and debilitating stroke, and it was proven to be a result of medical oversight. My dad is there motivating me to continue this work and continue to try to improve.
The patient safety initiative that I helped to lead that I'm most proud of relates to the implementation of a patient safety committee at the Drake Center. And the committee looks at patient safety events that have occurred at Drake. Most of those events are near misses, so it gives us an opportunity to look at events where harm did not actually reach the patient and allows us to focus on the errors or systems that led up to that particular event. We implemented EPIC in October of last year, and one of the safety measures that goes along with EPIC is barcode administration. And what I think we've done very effectively is create a culture of transparency where the employees, associates, anyone feels comfortable reporting patient safety events. Because if they're not reported, then we can't address them. So one of the things that we look at is the number of events that are reported each month, and that has increased. And our attendance at the Patient Safety Committee has, I would say, doubled. Our last two meetings, we actually just had enough seats.